So among patients with isolated RBD, which is RBD unassociated with another neurological condition, at least at the time of presentation, there have been some studies looking at the rates of phenoconversion to a neurodegenerative condition, primarily to alpha-synucleinopathies. Studies have shown a phenoconversion rate between 50 to 90%, with about a 8 to 9% rate of phenoconversion per year. Now, currently, we're still at infant stages in terms of looking at or predicting people who may convert to those conditions. But currently, we have a few things that we could potentially look at. So clinically, we can look at autonomic dysfunction, things like hyposmia and orthostatic hypotension can be potential predictors. More down the road, there will be more availability in terms of genetic testing. Again, it's in infancy right now, but another thing that is potentially promising is biopsy. So alpha-synucleinopathies tend to occur more peripherally at first and then act more centrally. So peripheral tissues that have autonomic fibers or innervation have been demonstrated to accumulate alpha-synuclein earlier. So in the future, potentially we could look at skin biopsy as being a way to predict whether someone with isolated RBD may potentially develop RBD, a alpha-synucleinopathy in the future. So the usefulness of that would be if someone has isolated RBD, we could potentially monitor the increase in alpha-synuclein in peripheral tissue to potentially predict the phenoconversion to an alpha-synucleinopathy. So unfortunately, we don't have much at this point. There's ongoing studies looking at potential medications that we could use to intervene in this isolated RBD stage, right, prior to developing a neurodegenerative condition. But unfortunately, we don't have much in terms of prevention at this point. What I can say, which is consistent with the literature in Parkinson's disease and other neurodegenerative conditions, is that exercise has the most data supporting its use in terms of prevention, but unfortunately, you don't have too much just yet.